randomized controlled trials that compared oral and IV iron supplementation in patients with chronic anemia. So these studies was selected by our predefined inclusion criteria, and we focused on hemoglobin improvement, iron store repletion, and adverse events rate. So data were extracted and analyzed using a random effects model to compute pooled mean difference and odds ratio with 95% confidence intervals. So our primary objective was to assess clinical effectiveness of oral supplements versus intravenous iron in treatment of chronic anemia. Secondary objectives included evaluating the safety profile, adverse events, and patient compliance, and overall quality of life outcomes associated with each treatment modality. So we included 15 randomized control trials, and in those trials were 2,831 patients included. We found out that IV iron showed a statistically significant improvement in hemoglobin levels, and we can see in bottom right bar chart that in IV iron mean difference was 1.25 grams per deciliter. It was significantly higher in IV iron group compared to oral iron. IV iron was also more quicker in replenishment of iron stores in the same period of time compared to oral iron. In the middle, in radar diagram, we can see time to repletion on the right, and IV iron has almost 2 times higher score, 9, compared to oral iron, which was 5. However, oral iron had a more favorable safety profile with fewer adverse events, particularly concerning hypersensitivity reactions. And we can see that in radar chart in the middle on the bottom, that oral iron has lower incidence of adverse side effects, although it had other side effects concerning gastrointestinal tract. So due to gastrointestinal side effects, oral iron had a way lower patient compliance rate, and we can see patient compliance in the radar chart on the left. So IV iron there was also more effective because there were no associated with gastrointestinal symptoms like nausea or stomachache. So compliance rate also showed in a pie chart, and we can see that IV iron has 51.8% of compliance rate compared to 41.9% of oral iron. So to sum up, EV iron is more effective in rapidly improving hemoglobin levels and restoring iron stores in patients with chronic anemia. Oral iron could be a better option for those that prioritize safety and are at higher risk of hypersensitivity, and treatment selection should be individualized based on clinical urgency and patient tolerance profiles.
Okay, do you have any comments or any questions?
No, thank you for your time, and yeah.
Okay, and how about judges?
Thank you for your presentation. And I'm just curious about do you do the meta-analysis, right? How about the I-square between the study? The I-square heterogeneity.
We used data extraction by a randomized effect model in order to, since our studies were very heterogeneous, so we used that model to to minimize that heterogeneity of these studies, so that our results are more generalized in this way.
Because you expected that you might have the heterogeneity between study, right? That's why you use the random effects.
Yes.
And I just would like to
We-
know the
we
I-square.
wanted-
Yeah.
Yeah, we wanted to do a generalized study, and we didn't include specific subgroups like younger patients or patients with multiple disorders. So we didn't include that. We used a generalized model here.
Yeah, because it's like, I think for the subgroup analysis, it might be more precise for the result. I mean, comparing between these two methods, if you do the subgroup analysis, for example, for the some disease that related to hematological diseases, something, the supplement might be specific to each one, or you would like to focus just only healthy people or something like that. That might be more focusing and easier to do the further study on this issue. Thank you.
Okay, thank you.
Any more questions here?
Okay. Thank you for presentation. So I think you want to make the generalizability. That means you have a lot of subjects. My question is about the outcome may affected because of the disease of the subjects. Can you describe more about the underlying disease of the enrolled participant in each study or in general?
In general, what participants were selected and what outcomes were, right? I'm just clarifying.
Yeah, I mean the underlying disease, the cause of the chronic anemia in specific conditions or something.
In most cases, chronic anemia there was caused by chronic illnesses such as chronic kidney disease or multiple organ disorders such as heart failure with diabetes type 1 and 2. There were also studies that included young women, and also we included people that have that had post chemotherapy treatment effect. So yeah, it's very generalized here. We wanted to see just in general how patient reacts to different type of medication and which one would be more suitable in what case. So in order to do specific guidelines for some sort of disease in particular, we should need to conduct a different review and maybe even include more large-scale randomized controlled trials to make those guidelines reliable.
Okay, thank you.
Thank you so much.